Pain is a common symptom in patients with cancer. It can occur at any stage of the disease. It's often present at diagnosis, and indeed it's often the reason why the cancer is diagnosed. So maybe 40%, 50% of patients will have pain at presentation, although that figure varies according to the type of cancer. It's also very common while patients are still having treatment, and that's sometimes due to the cancer, sometimes due to the cancer treatment. And in patients with advanced cancer, up to 80% of patients can have cancer pain. Despite the fact that it's common, it's often very manageable. So patients don't tend to or don't need to suffer with pain. So cancer patients can experience a variety of different types of pain. They can experience pain due to the cancer itself. They can experience pain due to the cancer treatment. And of course, patients can experience the pain that everybody else experiences. So it's very important to differentiate between these different types of pain because the treatment is very different. In terms of the pain related to the cancer, again, there are different types of pain, and the underlying cause of the pain can be very different. So it's important that patients are properly assessed to find out exactly what is causing the pain so that they can be prescribed the right treatments for that pain. As I said, there's lots of different types of pain, there's lots of different treatments, and not all of the treatments will work for all of the pains. So we have lots of ways of managing cancer pain. I think there are still issues in terms of managing many cancer patients' pain. I think part of the problem is that we don't continually monitor patients' pain. And so it's important that patients and their carers, if the pain is not controlled, if the painkillers or the other interventions are causing side effects, that they contact the doctors, nurses looking after them and inform them about that. There's also some issues about some of the drugs we use, some concerns about potential side effects. And it's important that as healthcare professionals that we educate and reassure the patients and their family carers about the safety of these interventions and how to use them properly. I think also it's important that if patients' pain is not being controlled and the doctors, nurses looking after them don't have a solution to that problem, then to refer on to a pain or a palliative care specialist. There's a very small number of patients with cancer pain where there is nothing that can be done to improve their pain. And I would say actually all patients, there is something you can do to improve their pain, if not get rid of their pain. So communication, feedback is the most important thing, I think, to improving outcomes in terms of pain control and maintaining quality of life.